My names are Dr. Syengo. I'm a consultant psychiatrist. I practice at the National Mental Hospital, Madari Hospital, and also in part-time private practice. We actually, from WHO, we say that there is no health without mental health, simply because when you define health, it's not just mere absence of disease, but you have to be in a state of well-being in terms of your mental state, your physical state, your social state, and even spiritual state. So basically, absence of stability in any of those aspects would cause illnesses, and the health is interrupted. There are many psychiatric disorders. Some are mild, others are severe. When it comes to adults, the commonest is anxiety disorders, where people will have excessive fears. We also have depression, which is very common, especially among women. We also have psychotic disorders, for example, schizophrenia, which presents as disorganized thoughts and disorganized behavior. We also have conduct disorders in children, attention deficit hyperactivity disorder, where a child will lack attention or a child is hyperactive. We also have disorders which are related to substance abuse, things like drugs of abuse, like cannabis, like heroin, like cocaine, which will present with psychiatric complications. Apart from the fact that children can suffer from the common psychiatric disorders like anxiety, depression, there are also other disorders which are purely in children. For example, attention deficit hyperactivity disorder, which is called ADHD, is most of the time diagnosed in childhood, because if it's not diagnosed and managed, then by the time the person is an adult, they have had many complications. They are probably they're out of school, they're on drugs, or they're in prison. So ADHD is diagnosed when in childhood. We also have conduct disorders, where children have problems with behavior at home or at school. We also have defiant disorders. A child will defy authority and they will not obey authority. Those are the specific ones. Apart from the physical ones, which are related to either mental retardation or disorders of development. When we talk of mental illnesses, the causes are multifactorial. We have the genetic component, where some people are predisposed because of their genetic makeup. We also have environmental factors. For example, people have gone through certain stressors. For example, people have lost a parent when they are young. They are likely to get depression more. We also have other environmental factors like use of drugs, which can contribute to that. But generally, we say that we need to help everybody to know how to be able to adjust when adversities in life, because adversities will predispose one to stress-related disorders. Basically, when it comes to diagnosis of mental illnesses, because it's a diagnosis of exclusion, we lack, especially in government hospitals, we lack the MRI scans and CT scans, which are supposed to be used to exclude either brain tumors or other neurological disorders. So those are not very available. We also have biochemical tests which are not available in Kenya. For example, the diagnosis of schizophrenia, we are not able to assay the dopamine levels in the brain in Kenya. So in terms of diagnosis, there's a need. And when it comes to treatment itself, there's shortage of staffing. In terms of, we only have 72 psychiatrists in Kenya, and that translates to one psychiatrist for every 500,000 Kenyans. And again, we know that we require at least one psychiatrist for every 50,000 people. So there's a shortage on that. And to make matters worse, even out of the 72 psychiatrists, 3/4 of them are in urban areas, and most of them in private practice full-time. That means that the general mwananchi is not able to access them in the government hospitals. The society needs to deal with stigma. We know that mental illnesses is stigmatized, and no one who has suffered from mental illness is courageous enough to say they have been treated for mental illness. So we need to work on stigma. We need to accept mental illness like to be a disease like any other, so that the people who are suffering from it can be able to come out and look out for the right treatment. There is generally an increase in suicide rates and an increase in mental illnesses, purely because there are more stressors in this life than there were before. And again, when it comes to things like trauma-related where we have conflicts and trauma-related disorders like post-traumatic stress disorders. They are also in the increase. And again, if we look at poverty also, poverty increases the rates of stress and therefore the rates of mental illnesses. It's also in the increase. So we all need to be on the lookout. Actually, when we are dealing with mental illnesses, most of them, it's either a chemical in the brain which is being produced in low quantities or it's being produced in high quantities. That means that most of the severe mental illnesses, you have to keep replacing that chemical. Or if it's a high chemical, for example, when it comes to schizophrenia, you have high dopamine, you have to keep giving drugs which will lower the dopamine. If you are dealing with depression, there are certain hormones which are being produced in low quantities. You have to continue giving those drugs to boost the serotonin and the norepinephrine. That means there are people who will have to take medication for life. And that is not abnormal, because when you look at diabetes, for example, there are many people who have to take insulin or the oral hypoglycemics to lower their sugar. And these people will live with their medication for life. So it is not abnormal, because we have most of the chronic diseases, even hypertension, HIV, you have to live on medication for life. But there are also other acute disorders which can be treated once and they don't recur. When we talk of mild anxieties, when we talk of acute psychotic episode which have been precipitated by certain stressors, probably in your life a crisis has happened and it's sorted out and you're put on medication, you may never need to take medication for life. Basically, the society needs to be sensitive about symptoms which could lead to a diagnosis of a mental illness. For example, if you have a relative who you think, for example, is appearing sad, not happy, not interested to going to work, for example, they lock themselves in the house, they don't want to get out of their house, or somebody whose behavior changes all of a sudden, they become very aggressive, very arrogant. So you need to be keen and probably take them for evaluation, because you don't just assume that it's something which is passing, it might be serious. So basically, if you're seeing somebody's emotions, that is either happiness, sadness, is changing or it's unexplained, and again, if their behavior changes, like somebody who never used to be arrogant starts being arrogant. And again, I've talked of emotions, I've talked about behavior. Basically, if you're keen on that, and when you see a problem, you refer for evaluation, then we would rescue some of those things, because people who commit suicide, for example, will give a warning at some point. They'll either say it or they will either go and give out all their property. And again, probably you'll have seen they are not happy, they are not interested in going to work, or they have negative thoughts. They'll say, life is not going to be good, what is the use of me living? So when you are keen to those things, then you'll be able to help many people.